Cardiac conduction system is one of the most important parts of our cardiovascular system, which keeps our heart to beating, provide us the opportunity to continue our lives. I am Associate Professor Dr. Abdul Qahar Sarwari, professional of humanities, technology, and human communication, with a special focus of heart-brain contacts and communication. And I want to have a very short discussion on this important topic. The main parts of our heart's conduction system is AC node or centuriole node, AV node or atrioventricular node, bundle of Hayes or AV bundle, and two branches of AV bundle, also myocardium fibers or Purkinje fibers. The first and most important branch of conduction system is SA node. SA node is located in the right atrium near to the superior vena cava, and SA node is the main pacemaker of our heart. Actually, when the two branches of our atriums, the right and left branches are full of blood, which the right atrium receives deoxygenated blood from the body, and the left branch of our atriums receives oxygenated blood from our livers. Then, when the two branches are full of blood, then AC node shows the electric impulses to both parts of atriums, and through the contraction of atriums, the AV valves, which includes the tricuspid valve and also the mitral valves, will be opened and blood transferred to our ventricles. And after that, when blood transferred to our ventricles in our heart, then AV node allow the electric impulse to transfer into our ventricles to the bundle of Hayes, and also to Purkinje to start the contraction of our ventricles. When the blood transfers to our ventricles, the two AV valves, which is tricuspid and mitral valves, will be closed. And this process will make the first sound of our heart, which is S1, or starts the process of systole. And after that, when the electric impulse transfers through AV node to bundle of Hayes, and two branches of to left and right branches of bundle of Hayes into Purkinje fibers. Actually, when we say bundle of Hayes, that bundle or structure of that electric systems that comes from AV node to Purkinje fibers. This continues across the two sides of our ventricular septums, and also Purkinje fiber. They say because these people, Hayes and Purkinje, discovered this part of the conduction system. And when electric impulses reached into a bundle of Hayes and Purkinje fibers, and through Purkinje fibers into the myocardium section of our heart, which is the most important part of heart's mass, then our ventricular part will contract, and the contraction will start, and blood will be transferred through the semi-lunar or aorta and pulmonary valves will be ejected to the systematic system of our body. And after that, these two semi-lunar valves will be closed. And the second sound of our heart will be occur. This will be the second sound of our heart. The first sound, which we see lump, in the second dub, and this finish the process of systolic and start the process of diastolic. In these activities, we can actually through the assessment by the use of ECG or EKG or electrocardiogram system, or even through the use of M-Wave and other technologies that provided by biofeedback technologies that provided by Hormat and other some research in scientific research centers. We can assist in the PQRS complex and through the assessment of graphs. When we see the, at first it starts from the isoelectric line, which is without any special electric activity. Then it starts P wave. Actually, P wave indicates the start of pacemaking system in short of electric impulses through by SNO to through two sections and two sides of the atriums. Then it continues. This the PQ complex. PQ complex, the distance between SA and AV node, because when impulse starts moving to the AV node, the distance between two sections makes the PQ complex. PQ complex. Then makes the Q wave. Actually, Q wave is the contraction of two sides of our ventricular septum when it receives the electric impulses, contracts. Then the main and major parts of this complex happens. Then continues this is the R wave. Actually, R wave indicates the contraction of the major part of our ventricles, because when the impulse reaches to the Purkinje fibers, and Purkinje fibers send the impulses to our myocardial section, this contracts of the heart. Then that heart wave, which is the main or the major wave of the PQRS complex, it makes. Then it continues until the T wave. PQRS S wave actually are PQRS. S wave is the contraction of the second part of the ventricles, and also transferring the blood through the semi-lunar valves or aorta and pulmonary valves. After this, after the completion of the systolic process, actually our ventricles start repolarization or start the relaxation, and the process of relaxation makes the T wave, PQRST, the T wave. Actually, the relaxation and repolarization of our atriums also make a wave, but because of the existence of a large wave, which is RF, we cannot see that. And that's why, if we want to know about the actions and reactions of our cardiovascular system and conduction system, we have to assist through the use of ECG or M-Wave and other technologies. Actually, our normal actions and reactions of the PQRS complexes, three categories. The first one is a normal one. We can see that AC nodes rhythm or normal rhythm, which is from 60 up to 100, 60 up to 100 rhythm or pulses. This is the optimal or most helpful process of actions and reactions of our conduction system. But if a smaller or smaller than 60, the rhythms are smaller than 60, the rate, we can see that the bradycardia also has, we can see it normal, but a little lower than the normal one. And if it's, the rate is higher than 100 or more than 100, this is bradycardia. But the most helpful and optimal level is that's AC node rhythm, which is from 60 up to 100. And we can conclude this assist the process of action reactions and conclude the overall well-being of our heart and our cardiovascular system through the assessment of the process of actions reactions based on the assessment of PQRS complex, which is a complete cycle of heart's action or a complete cycle of heartbeat, which starts by the shutting off by the pacemaker, the action of pacemaker, which is AC mode, and transferring of electric impulses to both sides of the atrium, and also transferring through the AV node to bundle of phase, Purkinje bundle, and also actions and reactions, all parts of the conduction system and all parts of the heart to keep us alive, to let us to continue our lives and keep us alive. That's why we can use some technologies and techniques to assist the process of actions and reactions of our conduction system, of our cardiovascular system, and also our heart. If you want to see more videos, please subscribe the channel. Thank you.